Hi everyone, thank you for tuning in for today's YouTube live video. I'm Alexandra, the brand product specialist for MDPen. For today's video, I really wanted to do a video that could reach both patients and also professionals. I will most be talking in the sense that I'm talking to a patient. However, this will be hopefully great tips that professionals can take away from this video. So I wanted to talk about the do's and don'ts of treatment day, what to expect on treatment day, and also what type of products and home care you'll want to do day of treatment. So the first thing you can expect on treatment day is to arrive at the med spa or doctor's office. Maybe you've been there before already for a consultation. Maybe you're an existing patient, but do expect to sign a consent form if you haven't already. The consent should be directly speaking and pertaining to microneedling. We are talking about the MDPen treatment here. One great thing about being a professional with MDPen is we do have our own consent form that you can definitely make your own. It covers absolutely everything. So as a patient, make sure you're signing a consent form. This covers you as well as your provider and lets you know what to expect, what you're agreeing to. Next thing, definitely know that you'll probably have before and after photos taken of you. Definitely a before photo. You don't necessarily have to take an after photo of your, patient's sunburnt looking skin, but you do want that before photo so that at the end of the series you can take that after photo once the patient is fully healed and looking amazing, and that's what you'll have to compare to the treatment. So knowing that if you have a morning appointment, don't go in with a full face of makeup. They are going to cleanse it right off and see your skin as is without the makeup. So yes, of course you can wear a little sunscreen to your appointment, but know that they will be cleansing off all makeup to apply your numbing cream and to take those excellent before and after photos. So the next thing you can expect is to have hopefully our MDPen hydrating cleanser used to prep you. You will have a topical numbing cream placed on you, typically for about half an hour. So you can bring something to do. You may just want to sit there and relax, with your eyes closed. You may be still speaking to your provider, something like that. So, but be prepared, to sit there and hang out for half an hour while that numbing cream really gets the chance to absorb. So of course, during treatment, you can expect to be comfortable because you have been numb, so no need to be nervous. And what you'll typically feel more so is just pressure on the skin. If you do feel slightly uncomfortable, it can be usually the forehead area, but once you've gotten through that, the treatment on the cheeks and all the way down should be pretty comfortable for you. After the treatment has been completed, you can expect to feel tingling sensations like a mild sunburn coming on. It does subside within a few hours. You don't need pain medication. You really don't even need, NSAIDs or ibuprofen, nothing like that. It's not that extreme. And know that your provider will go over aftercare with you. The morning of treatment, you want to make sure that you haven't heavily exfoliated, make sure that you haven't had neurotoxin within the last 2 weeks, no fillers within the last 2 weeks. If you've done a moderate peel or photofacial, make sure you're a good month out from that before you do the microneedling treatment. And make sure when you go home that you have all the proper products. Hopefully you guys have already consulted. Maybe they've bundled your home care in there. But if they haven't and they're missing this, which hopefully they're not, make sure you say, what am I using after this? Because chances are you might not have the right products at home and you don't want to use anything medicated on the skin. So if you don't already have a gentle, hydrating, fragrance-free, cleanser at home, then your professional should definitely be retailing you MDPen's hydrating cleanser. You'll definitely want to have this completely organic, botanical, yet gel-based. So it does give you a nice, clean feeling, especially if you are oily or combination, you will still feel clean after using this. And this is a great everyday cleanser. It's so gentle that you can even take off your eye makeup with it and not even flinch. It does not hurt. Same thing as once you're, irritated, maybe even slightly peeling a few days later from the microneedling, this cleanser is not going to upset anything. One big thing you want to make sure that you have, and you will sense your provider using it during the treatment, they will use it at the beginning of the needling treatment and at the end, is our HA Copper Mist. Make sure you guys are retailing this to your patients. This is a product that they must have. So they must have this, and they must have a moisturizer, whether it's one of our serums or the human-derived growth factor gel. But this is the minimum of 2 products, and you'd want one of them to be the HA Copper Mist. This is their hands-free product. So the day of treatment, you're going to be using this every 2 to 3 hours. You're going to want it. Your face feels tight. Your face feels dry. You can take this out of your purse, wherever, and just mist your face. Hopefully you're not out and about. You really need to get, indoors to your office, back home, wherever. You don't want to be out running errands in the sun. So that's something you need to plan for a day of treatment, to know that you're going to, get in your car and go home. Your provider may tell you to bring a wide brim hat or something that you can wear out to your car. And hopefully if they are requiring a mask within their facility, they need to be supplying you with a clean mask, unless you want to bring multiple masks with you to your appointment. But make sure that mask that you put on at the end of the treatment is a clean mask, and then you can go ahead and leave. But you do want to make sure that you have this ready. As far as the serums, like I said, typically you can retail or buy the pure HA serum, the cellular renewal, or the tighten and lift serum, and your provider can guide you on which one they think is best for your skin type, which one you'll get the most use out of. Perhaps they've already retailed it to you or included it, in your treatment. The other thing, of course, is going to be the human-derived growth factor gel, which hopefully they'll put on at the end of your treatment, so you will see how it feels. This would be the best thing that you could take home besides the HA Copper Mist. This is going to help you produce your own collagen even more. This is a nighttime moisturizer that's going to help you long-term build that collagen. So whether it's fine lines and wrinkles or acne scarring, you will be using the human-derived growth factor gel. And it does come in a smaller size if you do not want to commit to the full retail size. So there are different options there as far as that goes. You want to wait a good 6 hours before cleansing your face, and you'll want to use like a tepid warm water with the hydrating cleanser if you do need to cleanse at 6 hours. If you've done your treatment at 4, 5, 6 p.m., you don't need to cleanse that night. You can wait until the next morning. But if you've had a morning treatment and you've gone throughout the day moisturizing and misting yourself, you can definitely cleanse your face that evening, especially if you're someone that needs that really clean feeling on their face. I'm one of those people. I just can't wait to cleanse my face after treatment. So that's no problem. Make sure you go home and have a clean pillowcase on your pillow. Hopefully you guys are changing your pillowcases once a week. This is one of the best ways to prevent acne, prevent bacteria, and just keep things, nice and clean. So make sure you have a clean pillowcase when you go home and sleep that night. Make sure you have all the things that you need. If you're tempted, to use other products, clean off your vanity, your sink area, so you're not tempted, to grab a vitamin C or something that you would typically use. Know that your regimen is going to be very light for the next week. Your regimen is going to consist of cleanser, serum, gels, creams, sunscreen. That's it. It's going to be very small. So you definitely don't need to overwhelm yourself with product or something that you will forget. Obviously, the day of treatment is not a day that you want to be at the gym. You do not want to be sweating. This is going to be very irritating. Also, don't want to be doing any type of like home repairs, gardening, nothing where, dirt, debris, anything like that could get into your skin. Not the day that you want to whip out, bleach and chemicals and start cleaning your bathroom and getting low and scrubbing your shower. You will definitely get an irritation, rash, or worse on your skin. So you do want to, take it easy, pamper your skin. Remember, these are open injuries to the skin, the top epidermal layer gone, exfoliated. So you have to be very careful. I want to go ahead and open it now for Q&A. Again, we are talking, guys, about what to expect the day of a microneedling treatment. So day one, what to do, what not to do, and what to expect as far as your care and what you'll be using. To reiterate your care, you can cleanse after about 6 hours if need be. You're going to use our hydrating cleanser. Expect to be using our HA Copper Mist. every 2 to 3 hours to moisturize your skin, hands-free, carry it in your purse, and then expect to be used some type of hydrator, whether it's in serum form or the human-derived growth factor gel, or perhaps both. So definitely do whatever your professional is telling you to do. It's great if you can buy them in advance. So if you've already had an appointment with them, go ahead and purchase it ahead of time. That way, the day of your appointment, you can schedule your next appointment and then just check out and leave. Get that clean mask and walk out the door. Say thank you, bye. And rather than having to stand at the front desk and be like, oh, should I get, the serum and the gel, or should I just get the mist? I have this cleanser at home already. Make sure that you just already have it done. It's so much easier for you. It's so much easier for your provider. It's going to save a lot of time. And make sure that they've given you some type of written instruction, whether it's a post-care sheet for microneedling that they already have, in their system. Perhaps they've emailed it to you, or some type of checklist where they've said, AM use this, PM use this, and then your order of products that you'll be using there. So things like that can be really helpful. Any questions, guys? I wonder if I'm answering all your questions. Let's see. Okay, I see them now. How do I prepare my skin before treatment? So you want to take a week off from your retinol, vitamin A products. And as I said, do clean the morning day of. Just go in with clean skin. Easiest thing you can do. The main products you want to be taking a break from are going to be the alpha hydroxy acids, beta hydroxy acids. Those just do a couple days. But with the retinol, vitamin A, make sure you're taking that full week off. How long does it take for the skin to heal after microneedling? So this is going to depend on the condition treated, the person, their skin type, and also the depth and speed that was used. On a traditional anti-aging treatment, which can be done at 0.5 millimeters to the entire face, perhaps a medium speed, medium to high speed, these are the people that are going to look pretty recovered within 48 hours. So this is where you see that microneedling having no downtime. And really the next day they can use, a tinted SPF, certain types of mineral makeup, and really you can look like you had absolutely nothing done. Now, in cases where, let's say you had acne scarring, you had a few chickenpox scars that were stamped over, in these cases of a 1.5 depth or higher, you may have, 4 days of blotchiness. If you have darker skin, Fitzpatrick, 4 to 6. Hopefully, your professional is not treating you at a very high depth on the first treatment, so you can see what your downtime is like. But in those instances, especially at higher depths, it could be a week. So don't let that scare you that you're not that person that has the 48-hour downtime. And by a week of downtime, again, it's not something that you can't cover. I compare it to a bruise. With microneedling, you're going to look the most red, I guess beat up per se, but you shouldn't look beat up because it's going to be a very consistent look on your face besides those stamping areas. So like a bruise, it's going to get darker, going to start to fade over time. So just give it that time to fade. Do not worry. Even if you see tiny little red dots under your skin following the treatment, these are not permanent broken capillaries. They're not hemangiomas. They're not telangiectasias. They are going to heal. So often on my skin, which I don't think I have necessarily rosacea, but I can definitely see those tiny little pinpoint bleeding marks under my skin, and they're gone within 2 days. So don't let that scare you. If you're someone whose skin looks like that following microneedling, it will definitely get better. Can I work out after getting a microneedling treatment? This is asked so much. Some people are so active and so healthy, which is so great, but don't go to the gym. It's not a clean environment. Even at home, you really don't want to work up a sweat that first day. Of course, if you want to go for a nice brisk evening walk with your dog or something, that's not a big deal. You can come in and cleanse your face afterwards with our hydrating cleanser. You can use our mist, but don't do anything where you could be working up a sweat or being in a dirty environment. If you choose to work out on day 2, which I will talk about more in the next video, expect that you could have some irritation, but I understand there's some people that just cannot take 2 days off from the gym, but keep that HA copper mist next to you and understand that you could, reactivate some redness, reactivate some irritation. Just, keep that in mind. How long should I stay away from alcohol after microneedling? Are wines okay to drink? Cocktails, perhaps. So that gets asked too, no problem. Really, I would say the 48 hours before your treatment, avoid drinking. That's going to be more important, I would say, than necessarily drinking afterwards. So those 48 hours, try not to drink. It's just going to make you more prone to bleeding, possibly bruising. So similar, to neurotoxins and fillers, same thing your provider would be telling you with that. Honestly, my medical director and medical directors I've worked for in the past would probably say there's nothing wrong with having a single drink the evening of the treatment. If you do feel like, you're someone who needs that tiny half glass of wine or something, one drink isn't going to be, a terrible thing. Don't go binge drinking after your treatment. But typically once the treatment's been done, it's not going to be too affected by your drinking. If you do have rosacea and alcohol is one of your triggers, then yes, keep that in mind. And you may not want to drink at all for a few days after your microneedling treatment. So thank you for asking that question, the exercise question, all very common when it comes to this. What skincare products should I not use before my microneedling? Okay, I think I covered that. Avoid the retinols, guys. Take a few days off from alpha hydroxy acids, beta hydroxy acids, benzoyl peroxides. If you're on topical prescribed acne medications, that aren't vitamin A or retinol, I would take a few days off from those. Awesome questions, guys. Thank you so much. So the next video next week, I'm going to get more into the other days following the microneedling treatment. Today, I wanted to really focus on day of, what to expect. Another thing I'll say, and I should talk more about male treatments too, but men should not shave morning of. If they can shave their face a day prior, that's much better. There could be a lot more irritation if you are shaving the area morning of. You're just opening things up to irritation. So if men can remember, try to shave the day before. I just thought of that on a whim. So same thing, with body treatments. If you're having, a stretch mark treatment done, you don't need to be like overly treating the area. Some people do have prescriptions for retinols, vitamin A for their stretch marks from their dermatologist. Maybe even a hydroquinone compound for some areas of their body. These are things you want to take a break from. So make sure you're reading the ingredients in these compounding type of creams as well. I hope this video has been helpful. I will see you guys next Tuesday at 10 a.m. here on YouTube Live. Hopefully you can see that banner at the bottom there, and you can watch us on all of our social network platforms. We have Sydney live on Instagram. I am live on YouTube, LinkedIn, and Facebook every week. We would love you guys to be able to participate in all of them or just come back and watch them at a later date. So thank you guys. Bye.